Hi, today I'm going to show you how to dissect some of the cat muscles.
Pectoralis.
You're going to see a lot of fascia, so your cat's going to look just like this side right here. You have to peel off all of this fascia first, and once you peel off the fascia, they'll start looking like this. You'll be able to see the muscle. The fascia is the tissue that connects the muscles. So the pectoralis is located right here. Right along this line is where you make the incision, where the fascia is, and then you will be able to peel back the pectoralis. So number one, this muscle here, number one pinned, is the pectoralis.
Biceps brachii.
As you peel back the pectoralis, this will be the biceps brachii.
Triceps brachii.
The triceps brachii muscle. There. Number three.
Pecto antebrachialis.
For the pecto antebrachialis, once you peel back enough of the fascia, you'll see a little white line separating the pecto antebrachialis. This muscle right here, number four, is pecto antebrachialis.
Pectoralis major.
Pectoralis major. This can be this muscle right here as we go down inferior to the pectoralis antebrachialis. Pectoralis major is going to be number five.
Pectoralis
minor. It's going to be down lower here. And this is going to be a lot larger than the pectoralis major. In humans, it's just the opposite. Our pec major is a lot larger than our pec minor. So the pec minor is number 6, and it's this muscle right here.
Xiphi humoralis.
The next muscle we're doing, Xiphi humoralis. This muscle right here. And that's going to be number 7.
Rectus abdominis.
The rectus abdominis. And that's going to be this superficial muscle closest to the surface. Just right here. It's going to be the rectus abdominal muscle. And the muscle is going to be covered with a lot of fascia that has to be peeled away in order to see the actual rectus abdominal muscle.
External oblique.
The next muscle is going to be the external obliques. And what you have to do is you have to follow this fascia line right along here. And with the oblique muscles, you have to be careful not to go too deep. If you go too deep, you'll be into the viscera, which you don't want to do. You want to see the different layers. So these muscles are very thin. You have to be very careful and go along the fascia line, and then you'll be able to peel back the muscle. This first layer here, number 9, you can see how thin the muscle is. This is the external oblique.
Internal oblique.
This muscle is going to be the internal oblique. And once you peel back the external oblique, you will have the internal oblique. If your cat is very thin, you can actually see how thin this muscle layer is. Now, if you dissect in too deeply, you'll be into the viscera, which you don't want to do. So number 10, this muscle right here, that's going to be the internal oblique.
Transversus abdominis.
Next muscle, the transverse abdominis muscle, is going to be underneath the internal oblique. And how do you know when you have seen that? You'll see the transverse fibers of the transverse abdominal muscle. Transverse abdominal muscle is going to wrap around the abdomen. So this muscle right here is a transverse abdominal muscle. If you cut through this muscle, you will see the viscera, the intestines, and the other organs, which you do not want to do. So that's why you have to be very careful to separate out these three layers of muscles, because they're very, very thin. You do not want to cut into the transverse abdominal muscle.
Latissimus dorsi.
Okay, next we're going to be doing the latissimus dorsi. So we're going to cut along the fascia line. And we'll use our probe to clear out the other fascia. This muscle right here, number 12, it's the latissimus dorsi.